Hello. Welcome to Dr. Jeff Talks About Sex and Intimacy, the podcast where we have open, honest, and evidence-based conversations about sexual health, relationships, and intimacy across the lifespan. I'm your host, Dr. Jeff Albaugh. I'm so glad you're here. Today you're joining us for episode 54, Erectile Dysfunction After Prostatectomy, Causes, Recovery, and Hope. Most importantly, hope. Whether you're watching live or if you're watching the recording later, I just want to take a moment to sincerely thank you, listener, for being here. I can't tell you how much it means to me that you join us and come to learn more about these important topics. You are the reason that this podcast exists. Your engagement, your curiosity, your willingness to learn are what makes this all worthwhile for all of us, my expert guests, myself, and behind the scenes Vixenese. We're connected across so many platforms. We're on Facebook. We are on YouTube. We're on LinkedIn. If you're joining us on X, we are so happy you're here, but you may need to submit your questions, and that means you got to hop over to YouTube, LinkedIn, Facebook, or StreamYard so you can interact with us directly. A quick favor, if you are a Facebook person, the more people that follow us on Facebook, the more we can do on Facebook. So please be a follower, and to our followers and all those who watch, thank you so much. All right, so visit the website. The website is where you can learn about all the previous episodes. There are 53 episodes that you can go back and watch. Some of them are 40 minutes long. Some are an hour and 15 minutes long with the most amazing expert guests. So please go watch those. They're all there for you anytime you want to see them. You can pull up the calendar and see what's coming up. We have these amazing episodes coming up this year. All the way through April, we're programmed. So we hope you join us. We have very practical things, and we also have wonderful relationship things as well from many, many experts. So please visit the website. So you can take us with you. I don't know where you're going, but wherever you're going, take us with you. The thing is we're where you are. We are on your favorite streaming services, on Spotify, on Amazon Music, on iHeartRadio. If you're in the gym and you're working out, take Dr. Jeff with you. If you're on your road trip, learn more about sex, intimacy, and relationships. Deepen your relationship. If you're with your loved one in the car, you can both listen, and it might spark some great discussions. As always, I'd like to take a moment to welcome everyone and say that every single person is welcome here. Whatever your sexual orientation, your gender identity, whatever your relationship style, we're so glad you're here and you are welcome. The mission of the podcast is simple. If you're wondering, well, what is the podcast all about? It's really simple. It is just to empower you and enlighten you with the evidence-based, that's the science-based information you need to improve your sexual health and to deepen your relationships so you can live this one miraculous life, this wholehearted, beautiful life you've been giving more fully and with more love. Who doesn't want more love in their life? So I hope it helps you with all that. Tonight we're talking about erectile dysfunction after prostate cancer surgery. You probably know a man with prostate cancer because about 1 in every 7 to 8 men will have prostate cancer in their lifetime. And so often they will have treatment, such as surgical treatment, the most common treatment for prostate cancer. But even though it's the most common, sometimes it can be a distressing thing because side effects that men and their partners face can be problematic. For many, it brings fear, maybe grief, questions about identity, masculinity, and whether intimacy will ever feel the same again. But erectile dysfunction after prostatectomy is not a failure, and it's not the end of a satisfying sex life. Today's episode is about understanding why erectile dysfunction happens after surgery, what recovery really looks like, and most importantly, where hope lives in the healing process, where hope lives in that healing process. We'll talk about nerves and blood flow and timelines and rehabilitation and realistic expectations. while also addressing the emotional and relational impact and often goes unspoken or untalked about. I'm honored to be joined by one of the world's leading experts in erectile dysfunction and sexual medicine. That is Dr. Arthur Burnett, who has spent decades advancing both the science and the humanity of erectile recovery after prostate cancer. He is an internationally recognized urologist, surgeon, researcher, and thought leader in sexual medicine. He is the Patrick C. Walsh Distinguished Professor of Urology at Johns Hopkins University School of Medicine, and he serves as the director of the Sexual Medicine Fellowship Program at Johns Hopkins. Dr. Burnett is widely known for his groundbreaking research on the neurobiology of erections and erectile dysfunction, particularly in men recovering from prostate cancer treatment, and that's why he's here to share his expertise with us tonight. His work has fundamentally shaped our understanding of penile rehabilitation, nerve injury, and recovery following radical prostatectomy. That's a whole lot of medical jargon, but we will get you through it. He is a past president of the Sexual Medicine Society of North America, and you've heard me talk a lot about SMSNA on this program, and we have many speakers from SMSNA. And he is a prolific author and of peer-reviewed research and textbooks. Dr. Burnett is also deeply committed to patient education and compassionate care, and that's why he's here with us tonight, sharing his time. His ability to translate complex science into clear, empowering guidance has helped countless men and couples regain not just erectile function, but confidence, intimacy, and hope. I couldn't be more honored to welcome my friend and colleague, Dr. Arthur Burnett. Welcome.
Welcome to me, and wonderful to connect with you, Jeff. That was just a wonderful introduction. Boy, I'm just excited to be here and just really overwhelmed and delighted to be part of your program.
I can't wait to get started, so I'm going to hand it all over to you. It's all you, Dr. Burnett.
Okay, well, I do have a presentation, and I want to also just echo some of the comments that you made about how important it is to just be authentic and just take that situations by the horns. Just be constructive and let's talk about sexual activity and intimacy and relationships and all the above. And this is all the more important in the arena here of prostate cancer management. So with this presentation for your listeners, and thank you all for listening, I want to talk to you a little bit about the matter of sexual dysfunction and specifically erection disorders that can occur in the setting of prostate cancer management. So next slide. Now, just about me, just briefly, you've heard that I am a surgeon and a scientist. I'm on faculty at Johns Hopkins in Baltimore, Maryland. I've been able to contribute to this field over many years. And I guess just the message I would just share is that, it's certainly we know that there's progress to be made and there's education that we can all learn and teach each other. So I've been involved in the area of sexual medicine and prostate cancer surgery for nearly 40 years. And I think I can give you my best perspective on how we can address the issues surrounding this. Next slide. So, by way of introduction, we know that there are several discussion points that I will bring to you with this presentation. Prostate cancer is common. We know that about 1 in 8 men will be diagnosed with prostate cancer. And, this is such a prevalent disease state that all men need to recognize that either they'll face it or a friend or a colleague, a neighbor will have this diagnosis. Along the way now, managing it by a variety of approaches, including surgery, radiation, and maybe even some lesser conventional options, still has this association of changing one's functions in the pelvic region. That can be sexual function as well as urinary function. And erectile dysfunction occurs very commonly in the setting of prostate removal. This has historically been a true consequence of the operation, the radical prostatectomy. And while we've made progress in the field, it still is an outcome that we need to recognize. And I'm going to talk about how we need to understand it, how progress is being made in the area, but nonetheless, how, as a listener here, how we can address this best for those who will have a prostate cancer diagnosis and then go forward with the surgery. Know that it is treatable, and that we do have options that can help men recover and have still a very sexually active and thriving life even after treatment. Next slide. So this term erectile dysfunction has been a more euphemistic term than the word we used to use a few decades back. The word impotence, I think we've kind of cast it aside. It just, that term is just too negative, has too many different meanings to it. It conveys a sense of powerlessness, and perhaps is even non-specific. So here we're talking about the difficulty in getting or maintaining an erection, the penis, for men having sexual activity, and the dissatisfaction that arises surrounding this. So certainly this is a condition that does associate with prostate cancer management. It can arise with other disease states, men with cardiovascular disease, diabetes, metabolic disorder, various other lifestyle conditions. These also are associated with erectile dysfunction. And with regard to prostate cancer management, including surgery, it can impact the structures deep in the pelvis that are responsible for how erections occur. So we're specifically talking about the nerves and the blood vessels that course deeply within the pelvis, the nerves regulating how the blood vessels react under situations of sexual excitement or local stimulation in the genital area. And then this drives the effective blood flow coming into the penile area. So we think about erections almost like a penile vascular function. And if you have trouble with erections, it's almost like a penile vascular dysfunction, like we have vascular dysfunctions elsewhere in the body. So it is a biological phenomenon. We recognize this. There's a science to it. And with that, I think we've come of age now to think about how can we address the factors that are involved there and how can we correct these. So erections are fascinating in terms of the science of them. And I think as we make scientific progress, we'll be able to address the problem better. But know that it is not a failure. And I want all men to know that they shouldn't kind of accept that it's something that they have a personal sense of shame or failure and something is wrong with me. This is something that can happen with prostate surgery, with the reality of structures in the prostate area with its removal that affect the erection response. Next slide. So why does prostatectomy, radical prostatectomy, affect erections? Well, the reality is the prostate is situated in a very precarious part of the body. It's in the deep pelvis, right below the bladder, right at the root of the penis, deep beyond the pubic bone, right in front of our bodies down in the pelvic region. And structures that govern the erection response principally are the nerves. Okay, we know the blood vessels that come into the root of the penis that supply the penis with circulation are not quite right where the prostate is, although some blood vessel injury can occur with the surgical procedure, but mainly it's the nerves. And we've learned that over the years that these nerves regulate how the blood flow occurs. And just in the course of removing the prostate, these nerves that are intricately surrounding the prostate and have to be, I guess, potentially impacted by getting the prostate surgically removed. This is what we call nerve injury in a variety of fashions. So just by even moving these nerves, let alone any kind of direct removal of the nerves, can lead to erectile dysfunction. So this is the reality of just where the prostate sits and the difficulty with regard to how the surgery is done in terms of how these nerves can be structurally damaged. Let's go to the next slide. So, one thing that I think has improved upon outcomes is this term called nerve-sparing prostatectomy. And this may be a common discussion these days, although it only evolved here in the past few decades as a technique when removing the prostate deep in the pelvis that we need to execute very well as surgeons. We know that while the nerves course around the prostate and they're very diffuse, we can gently dissect them off, like taking off an outer layer of the onion or something of that sort. These nerves are little fine, hairy, almost like very fine structures that of course within the surrounding tissue of the prostate, and we can do a very delicate dissection to remove the prostate and leave these structures to be uninjured as best we can. And that is really the concept behind nerve-sparing prostatectomy, and it's evolved now in the past 3 decades or so, and it's really part of how this surgery is done very routinely. Now, keep in mind, it requires that we make an early enough diagnosis as surgeons such that we can do a better preservation of the nerves, because if the cancer is starting to spread beyond the prostate, these nerves can be traumatized or do require local removal to get the entire cancer out. So it's a matter here of deciding case by case, with each man's presentation, are we able to just remove the prostate alone? Or if cancer is starting to spread, we do have to do a wider removal where nerve removal and injury can occur. So I want to get that point across, that the operation is to save a man's life with the primary goal of removing the prostate for cancer control. And we do our very best for nerve sparing, but it should be done under the right indications. Next slide. So what does it really look like? Okay, so you're hearing me say that, as surgeons, we do this surgery now in the modern techniques of dissecting the prostate out, saving the surrounding nerves when it's properly indicated to do so. But if we're saving these nerves, why do these nerves just misbehave? Why aren't they functioning? And it's just the reality that even while we gently dissect the nerve tissue off the sides of the prostate, remove the prostate, and so forth, and go about the rest of the operation, these nerves do get traumatized, and they get shocky, and they just don't seem to really work. It's almost like if you have some sort of nerve injury elsewhere in the body, a back injury, a shoulder injury, sometimes functions relating to where that injury occurred that is nerve regulated sometimes are dysfunctional for some time, and these nerves require some time to heal. And it's just the reality that these nerves are so delicate. They're deep in the pelvis. When they do get traumatized, even with just movement of the nerves, these nerves really can be dysfunctional for some period of time. So this is the reality of nerve injury, even when they're not surgically cut or anything of that sort. Next slide. So it does take time for these nerves to recover, and this is just the reality of how our body heals. The reality of tissue healing in the body, the nerve tissue, can take several months for recovery. And in fact, in my many years of being a prostate cancer surgeon, I've witnessed this. I've observed that many of my men who have done very careful nerve sparing surgery, that many may take as much as 12 or even 18 months, and sometimes even a little bit longer to get to the highest level of their recovery. And so it's not instantaneous, even when we do nerve sparing. So it's important to understand the reality of this timeline. And as we work in our field to understand the science of nerve injury and nerve recovery, hopefully we'll develop better therapies that can expedite and hasten the recovery of these nerves along the way here. But just natural, spontaneous healing can take some time. Now, keep in mind now that there are various factors that have to do with a man's erection ability and how well he can recover. So the conversation I always have with my patients is to review other factors in their health, their baseline status of function. Do they have any other health conditions that may adversely impact their sexual ability and their recovery? And so we have to understand all of these factors: their age, your health, how you were functioning prior to surgery. Certainly that baseline level is the best that we think we can bring guys back to, but not necessarily more than that. And then just again, as you heard me mention earlier, the extent to which nerve preservation is done, the nerve sparing technique, that procedure then is variable depending upon, possibly in some men's cases, if this cancer is starting to progress, we have to do a wider removal, and there will be some reality that patient will not have a natural function recovery even with time. So all of these factors have to be understood. Next slide. Now, along the way, one concept that we talk about is that We want men to still stay in the game. We want you to not just say, well, here it is, a month or 2 months or even 5, 6 months, and even up to a year after the surgery, I'm getting no erections, and I'm just, very dismayed by that. And what we try to do and really emphasize is let's work with you. Let's talk about rehabilitation. Let's talk about various therapies that we think can strategically be applied to help the nerves and the blood vessels stay as functional as possible. Let's talk about erectile dysfunction treatments that can be explored to keep you active sexually while we're still awaiting your natural function recovery. So these are the concepts here behind penile rehabilitation, just to keep you still in the game, so to speak. And we think that this early treatment is certainly recommended, not just for healing, but also just to maintain your activity surrounding sexual function and intimacy with your partner. Next slide. So what are treatments that are available? We have evolved greatly. I can tell you I've been involved in this field now for nearly 4 decades. Back when I did my early training in the 1980s, we did not have many options for men for erectile dysfunction, whether it's in the setting of prostate cancer surgery or radiation also being a factor that can affect erections, or with any other disease state that can occur, diabetes, cardiovascular disease. We had some very basic oral therapies that were not very effective. We had a very primitive kind of penile prosthesis device. So now here we are a few decades later with some options here. We have oral medications that are based on science. Okay, you commonly, terms you commonly know are Viagra and Cialis. These are oral medications that are based on the science of the nerve tissue and blood vessel function within the penis, and they are very effective therapies. Although, let me make this point, these therapies are most advantageous to augment erections, and they have their best efficacy in men who've had nerve sparing, whereby these medications take advantage of the chemical process of nerve release of the nitric oxide chemical that makes the blood vessels react, and then they work synergistically to help the erection response. So men who have not had nerve sparing surgeries, these medications are likely to be ineffective, not likely to be helpful. Now there's vacuum devices and injections. These are various therapies that can be done non-surgically, that can be applied to the genital region, and they're on demand. Urethral medications also are there, although I think these are fading somewhat in our standard armamentarium, because the vacuum erection devices and injections are much more effective in general. But again, training to how to do these with on-demand usage each time you want to have sexual activity is how these options can be made useful to you. Know that they do not necessarily accelerate your natural function recovery. We still are trying to work on therapies that can achieve that, but at the same time, they do not interfere with your natural function recovery. So they can be done. They don't burn any bridges. They're not irreversible. They're options that can allow you to achieve erection responses and still be sexually active while possibly awaiting your natural function to recover. Now, penile implants, the last thing you see on that list, is the surgery. And so that is considered to be a surgical option, whereby a device is placed surgically within the penis, serving much like a splint for the penis, that then can create the stiffness whereby a person can engage in sexual intercourse that way. Everything else about the penis is intact. Sensation, the ability to have arousal enough to have an orgasmic response, the way it feels to a partner with sexual intercourse, all of that is retained. So the penile implant, simply enough, is a internal splint to provide stiffness. Now, what the bottom of the slide says is the right treatment depends on each man's situation, and there is no single solution for everyone after a prostate cancer surgery, radical prostatectomy. And that makes the point that we recognize that all of these are options on the table, and all men have in my mind, the availability of these options. And then it's a matter of reviewing what option makes sense for that man based on his preferences, based on maybe his partner's interests, and so forth. So we want all men to know that all of these options are potentially available to you, and it's a matter of discussing the pros and the cons, and understanding which option makes the most sense to you. But I do stress the point here, once again, that the non-surgical reversible options, not the penile implant, may be something to explore early on post-surgery. If there's at least the sense that you have had a nerve-sparing operation, and we are hopeful that your natural function can recover and do something along the lines of these more reversible options that don't burn a bridge, if you will. The penile implants, although very successful, means that you've committed in such a way that your natural function is going to be at this point just dismissed, and you're going to move forward. Next slide. Now, part of the discussion, as Dr. Jeff had mentioned, is that there's other aspects here about the not just the biology of sex and devices and pills and this and that. That we understand that sexual health is a mind-body experience that does have some impact in terms of how we function, and also how it contributes to the dysfunction, but also is a consequence of the dysfunction. And I want all men to know that we don't want you to feel any sort of shame, so any sort of embarrassment about having challenges with your sexual function. It's a common thing, and we should just address it a very forthright way, and then move forward to say, okay, let's build the best strategy that you want to have to keep you going and feel that you can continue to have sexual activity and have the intimacy that you want to have with your partner. Next slide. And I encourage all men to speak up. All too often, I'm saying, men many times just remain silent, and they just say, okay, well, this is a consequence I'll just have to live with, and perhaps they're not seeking out the care that they deserve. I want all the listeners here to say, you know what, if you're talking to your care provider, be it your primary care doctor, who may also be seeing you after a surgery, or even the urologist who performed your surgery, if they're not talking with you about preserving your best functions and keeping your best quality of life sexually, not just the urinary control and other bodily functions, but even sexual function here, then seek out a consultant. Seek out someone who will address these concerns and help you preserve your best function and reassume the sexual health that you want to have. So please hear me on being proactive and taking charge of your health and taking charge of regaining your sexual life. We should open the door to anybody who wants to preserve these sort of aspects of their life, by all means. Next slide. So the future is bright to the extent that we continue to understand the science of erections. We are perfecting the surgery. We're perfecting radiation. We're bringing other treatments to prostate cancer management that you may have heard about, focal therapies, which is a variety of new options that are being investigated. May not be prime time just yet, but being investigated that may treat prostate cancer and hopefully have less consequence in terms of effects on sexual function. So know that we're evolving the specialty of prostate cancer management. We're understanding the biology of nerve injury and nerve healing, and there are new therapies coming along here that are going to have some impact on how the nerves heal better and recover function better. We're going to continue to bring forward the best erectile dysfunction treatments as well going forward with better options that will achieve the best success for you. So know that where we are right now is a great success from an improvement from where we were a few decades back, but we're going forward as well with therapies that will bring the best outcomes for our patients. Next slide. So my message is one of hope. Dr. Jeff made this remark early on. It's one of hope. It's one of taking charge of your life. It's one of knowing that we should not give up on you, that we not only want you to survive, but thrive. It's all about survivorship, but also thriving. And know that retaining one's sex life is very important. Recovery is possible. And we do have various management options that can help you reclaim and achieve a full and satisfying sexual life and whole life after surgery. So I will conclude my presentation there. and hopefully I was able to provide some nice information. I'll gladly have further discussion next, I guess. So.
Awesome. That was great. Such good information. I love how you help people understand. We talk so often about how erections are really a neurovascular event. They require that communication between brain and penis and blood flow to fill the penis. And when you have the prostate cancer treatments, the surgery in particular, but radiation too, it impacts that communication back and forth between brain and penis and that blood flow that engorges the penis. And so I think it's really important for people to understand that. And you did a great job of helping them to further understand that this physiologic process that occurs with prostate cancer treatment. So I really appreciated that. And then too, really what this whole thing is education and advocacy. Really, that's what we're here for. And I love that you talked about, please speak up. Nobody advocates for you like you, listener. Nobody's going to advocate for you. One other person, maybe your partner. Right?
Well, that's true. And that's why I think that the point being is, and you just touched on it, is, the sexual activity, I'm sure you talked about this in your program many times, is many times a couple situation, and so, all too often, when a man has trouble with his sexual function and so abruptly sometimes right after radical prostatectomy, that creates a lot of strife between couples. I want to keep coaching guys and say, let's this is a partner's issue as well, and let your partner be a supporter, and let's work together and try to make sure they're understanding and supporting you as well.
Yes, and I found, and I know in your clinic too, we highly encourage people to bring their partners to these appointments. And partners are very engaged. They are really a part of the journey, and they're living every minute of it with that person. And so I think it's really important. Sometimes, all of us, your partner, you, whoever, whether you're the person affected by prostate cancer or the partner, everybody thinks it's them. Oh, they don't want to be sexual anymore because of me, or I'm broken, I can't be sexual anymore. But what I find is if we work together with the patient and the partner, engaging both of them, teaching them that, if you have an erection, you can have intercourse and penetrative sex. If you're not hard enough, you can still enjoy each other. You can have a wonderful time together. Your sex life is not over, regardless of what your penis is doing in terms of erections. And we can help you with the erections, but even if they're not occurring, it doesn't make or break your connection, your intimacy, your pleasure, and even your orgasms.
I couldn't agree more, Jeff, because I think that unfortunately, I think our society, and maybe this is my perspective on it, it focuses too much on just what's going on between the legs, as if that defines your manhood. And I would like to carry a message that, we are more than our penises, guys. A man is who you are and how you feel about your interaction with your partner and some other humanistic and humanity aspects of who you are as a man. So I'm not going to be judgmental about that, but I do want to make the point that guys, we want to first keep you alive. Second, we want to make sure you're there for your family, and then continue on with life in so many dimensions that are important to be who you are. And again, we don't want to minimize the sense of manhood. I think the one thing that I've witnessed sometimes, Jeff, is that sometimes partners will be supportive of their men and say, "Oh, don't worry about it. If you can't perform, it's not that big a deal." Sometimes that messaging, and for the listeners in your audience here who may say, "Well, I'm supporting my man by telling him that." Well, some men still want to feel like they are men here, and I want to tell guys who are who are in your audience that we're not trying to just say, pat you on the back, don't worry about it, even if you don't get erections. We want to figure out how we can keep you in the game, and partners. Don't minimize a guy by saying, "Oh, I still love you if you can't get erection." That's not what many guys, I think, want to hear. They still want to be able to perform. And so I want you to know that we should take proactivity. We should understand that we have options. We want to support you as men, although, again, you're more than your penis. But let's also bring these options that I've spoken about that can allow you to regain a sense of your sexual ability. And I think that's something that's just, at least my approach is, I support this. Let's get you functional again.
And I think sometimes that's just it. I think the partner's trying to say, your penis and your erections don't have to make or break it for me and my satisfaction. But, as men, we put a lot into our penises. I mean, let's be honest, we're pretty obsessed with them. And I think I find so often the partner's like, it's not, my focus isn't all of that. Yes, I enjoy intercourse. Yes, I enjoy his penis, all those things, but it's not my only focus. And for me, pleasure comes all different ways. So I think sometimes just reacclimating men a little bit that way, and their partners too. And then, yes, the good news is, just like you just spent all the time presenting and telling us, there are ways to get an erection. Everything is good and bad. You may or may not want to do some of those things, but there are definitive ways that have been around, honestly, most of these things for decades, with reliable ways to do it and to give you an erection so you can have penetrative sex. Make no mistake, we're not saying there aren't good and bad with everything, but there are benefits and risks, and you should understand those before you do things, especially something permanent like a penile implant. But we both know it has changed some of our patients' lives to do and integrate some of these treatments into their love play. We all have had that implant patient, and not saying it's for everybody or pushing anybody into it, who said, why did I wait to do this? This has been life-changing. What was I waiting for? And we have other people who are like, this is not for me. And it's okay either way. Who are you, listener? And what will be the best thing for you? And you don't have to do an implant. There's injections, there's the vacuum pump, there's the pills. There are things that may be beneficial for you. Nothing is for everybody. But gosh, are we lucky to have the things we do have. And then a few things on the horizon that I think may work adjunctly or along with some of the things we're already doing. So it's an exciting time.
I think it is an exciting time. And as I was able to present, and also you're saying here, which I agree entirely, is, we have to understand, each man, what his preferences are, what his approach to his relationship, but we have options, and all of these options are there for you. They're there if you want to move forward with various other forms of intimacy and sexual activity and other ways of finding sexual satisfaction. That's fine. Sometimes, it's a new stage of life. You move forward and you work with your partner and things go forward that way. Wonderful. There may be those other options here that can achieve the erection. Fine. They're both non-surgical as well as surgical, as you're saying. So, I think that the beauty of where we are right now is we do have options, and sort of we can work with you and understand what option is your preference, and bring those options to you.
And sometimes, as some of our patients are older, their partner, whether that's a male or female, can't really penetrative sex a problem on the other side, on the receiving end, because of vaginal genital symptoms of menopause and vaginal atrophy and dryness, shrinkage and dryness, or rectal issues, or whatever the issues may be with the partner. So it's not, when we look at our people having sex in their 70s and 80s and all that, it's not that they're not having sex. They are, definitely. Not everybody's having penetrative sex because of problems on the male or female identifying side, but people are still having sex and they're still enjoying each other, and you can be connected. So you can do any of these options. You don't have to do any of these options, but you have choices, and you do have options. And whatever you want to do, I think our goal as providers, I know in my clinic, and I know you find the same way, is it's patient-centered. What do you want? What are your goals? How can we help you achieve those goals? And if it means you're like, I want to be spontaneous and don't want to deal with any of that stuff, okay, we can help you with that. If you're like, I will do anything and everything, we will find a way to get you where you're trying to go. So I think patient-centered is where the American Urologic Association, the Sexual Medicine Society, is guiding it. What do you want? What do you need? On that note, we have a good question here for you. I did not regain spontaneous erections, and it's frustrating. How do I reframe success so we were just kind of talking about this, so I don't feel like my sexual identity or masculinity has been lost?
Right. Well, there's a lot packed into that statement. First, I want to congratulate the author here to be upfront about what's going on, and and say, I want to hear what you guys have to say about this. I mean, I appreciate that. So thank you for that comment and the question. Yes, there is frustration surrounding this. I think we acknowledge the emotional impact of losing erections. Spontaneous sexual activity is very much part of how people behave. That's where the joy of sex many times comes in. So I acknowledge that, and I hear you saying, how do you reframe your success when this has impacted your sense of manhood? And so, gosh, this covers much of the presentation, some of the topic areas. So I just restate that for to tell you how we're going to give you some thoughts here. My thought here is that we want you to regain your sense of manhood. That you can perform sexually. We do have some options here that can allow erections to occur. If you're still in the early stage of having had the surgery and within this less than a year interval, it's possible that with nerve sparing, if that was done, you may still regain function. Let's work with you with some kind of other, hopefully non-surgical things that may allow you to continue to be intimate and active if your natural function could potentially recover. So understand that. But if it's a little further along the lines, further down the road where your natural function just has not recovered, and we think a good year or two has gone by, we understand that maybe you're just not going to likely recover your natural function. We do have these management options that we have spoken about. The vacuum pump, the penile injections, these are very effective. The intraurethral suppositories, they're there, although I have to be honest, I don't think they're quite as effective in general. And if you feel that you want something that's a little bit more permanent, that you don't want to continue to do a treatment every time you want a sexual activity, you want something that's somewhat more spontaneous, there is the penile prosthesis, although it is a surgical intervention, obviously. So we have all of these options. Again, we talked about manhood and maleness and the reality that we're not going to just poo-poo the reality that some men will have dysfunction. We want you to be encouraged and supported that if you wanted to regain your masculinity, we have some options for you. Now, as a urologic surgeon, I can bring to you these treatments, but there's also counselors and therapists and others that can work with you. And certainly Dr. Jeff here may comment on some of that, because I think that this may be a multi-dimensional problem. It may be a matter of a variety of specialists can work with you multi-denominational, if you will, or multi-specialist kind of interaction. That if your surgeon is just not helping you out, well, find the right person and find out, for either a therapist or a sexual medicine specialist, find that person to work with you.
I couldn't agree more. And so as in addition to a board certified advanced practice urology clinical nurse specialist, where I have the urology background and prescriptive, I'm also a certified sexuality counselor. And so, listener, I would probably sit down and work with you on really exploring those feelings. What's going on with what you're feeling in terms of your sexual identity and masculinity after this, with that sometimes people call new normal. Your frustrations and your difficulties, and really kind of seeing what are those feelings, what are the different things that you're going through, kind of identifying, is that living somewhere in your body, and how can you now work on embodiment with things the way they are, with the changes, with the things that are there, thriving rather than just surviving in this new situation. Also, I want to put up, Vic has to find a therapist or counselor. I'm certified by the American Society of the American Association of Sexuality Educators, Counselors, and Therapists. That's AASECT, AASECT.org, and you can find therapists that way or counselors as well. But there's so much good work that could be done. And I think, Dr. Burnett, you did such a good job of saying, working past knowing that you are so much more, and you are not defined by prostate cancer or erectile function or any of those things. So that's the work I think that needs to be done. We have another great question, and that was an awesome question. Thank you, listeners. What advice do you have for couples like my partner and I who are navigating erectile dysfunction after prostatectomy, especially when one of us is ready to try treatments and the other feels discouraged, anxious, and emotionally disconnected?
Wow. Okay. Well, again, that's not an uncommon scenario, I don't think. There is I think the understanding that sexual activity is oftentimes a couple situation, and sometimes, yeah, there could be a little bit of a disconnect. In a positive or negative way. Like we mentioned earlier, there could be, a supportive partner who says, "Oh, I love you no matter what, even if you're regular." Well, that sounds great, but also that may not be quite, that's a little self-defeating. But if somebody also says, "I don't care about sexual activity," and they're distancing themselves, that's a problem too. So I think that the way to address this, I think, frankly, again, is to just, to try to come clean about it. Try to make sure we have a good, honest conversation with your partner. Try to figure out where they're coming from, and then possibly get some involvement by somebody who's a therapist and a specialist to try and understand what's important to both to that couple, your couple's interaction there, and where each of you are coming from, and maybe find a solution that makes some sense. And he may arrive at an endpoint that may differ between different people, but certainly taking action here and finding somebody who can interact with you to try and reconcile the differences and try to figure out how we can restore that relationship, restore that mutual love between those two individuals. I would certainly encourage that. Jeff, you have some additional thoughts on that?
Definitely. As well? All that. And I think really, I think, listener, working together, you have this wonderful, beautiful partner who wants to work with you, and you can both work through some of those emotions, some of those feelings, sit with those feelings of discouragement, anxiety together. And then where do you want to go from here? Boy, the fun can be figuring out how to work together on this and how you want to work together on it in the best way possible for both of you. Don't underestimate the power of play and fun. And remember, once you've sat with those feelings a little bit and you're ready to move towards enjoyment, connection, deep connection with your partner, trust me, I have worked with countless patients and their partners who have a very deep, meaningful relationship after prostate cancer treatment. And they really enjoy intimacy, sex, and love play together. So it is totally possible. And again, you can work with a counselor, you can work with a therapist on some of that, but work together. The best thing you have is each other. That's a beautiful thing. So, gosh, there's so much good information to unpack, and we thank the listeners for their great questions. And this has just been such a good episode so far. I'm going to come back to you in a minute, but I'm going to do a little bit of a centering exercise to get people, because it was a lot of information, and get them in a little bit different space. And so I'm going to move to our closing centering exercise. So before we close out, I'd like to invite you into a brief centering exercise, especially if this conversation brought up worry, grief, or uncertainty about your own recovery or your partner's recovery, because our intent was to offer you hope and let you know that there are treatments and there are things that can be done to help you have a fulfilling sexual life. But it's a lot of information and a lot of anatomy and physiology and crazy stuff. So get comfortable, put your feet flat on the floor, get in a comfortable position. Take a comfortable breath, slowly in your nose, and slowly exhale through your mouth. If you feel comfortable, place your hand on your chest or your lower abdomen. As you continue to breathe deeply in through your nose and out through your mouth, soften your shoulders. Let go of any tension you might be holding in your neck or back or jaw. Keep breathing deeply as you remind yourself quietly, healing is a process, not a deadline. Healing is a process, not a deadline. Excuse me. Erectile recovery after prostatectomy does not follow a straight line. Progress may be slow, it may be uneven, it may be frustrating, but the good news is it's still progress. With your next breath, acknowledge what your body has endured. Surgery, treatment, survival. With the breath out, release the belief that your worth, your desirability, or intimacy is defined by erections alone. Inhale, and as you exhale, let go of that belief that your worth, your desirability, your intimacy is defined by your erections. Finally, take one more gentle breath in. Hold the idea of possibility, new ways of connecting, new forms of pleasure, new chapters of intimacy. When you're ready, bring your attention back, knowing that recovery is real, that support is available, and that hope is not misplaced. It's real, and hope is powerful. And that's what my prayer for you is, that you have that hope and you know that you have ways to heal and be whole and feel whole. So let's talk about, Vic, hey, what do we got going on next week on Dr. Jeff Talks About Sex and Intimacy?
Sexuality is one of the most talked about parts of human life, yet also one of the most misunderstood. In this episode of Dr. Jeff Talks About Sex and Intimacy, internationally recognized psychologist and sex therapist, Dr. Stephanie Buehler, founder of the Buehler Institute, joins us to cut through the confusion. Dr. Buehler will take on the biggest myths about male and female sexuality, the ones that create shame, unrealistic expectations, anxiety, and relationship strain. Dr. Buehler breaks down what the science actually shows about desire, arousal, orgasm, sexual pain, performance anxiety, aging, and pleasure. Join us on January 20th at 7 p.m. Central Time to learn more.
Oh, there was some fireworks there, Vic. Thanks for that incredible intro to next week. And Dr. Buehler is amazing. She's written great books. She has a whole school for training for sex therapists. And so I'm excited about her joining us. But this week, wow, I just can't thank you enough, Dr. Burnett. It's always wonderful to see you. I love working with you and learning from you. And thank you for taking time out of your busy schedule to share your expertise with our listeners this evening.
Well, again, it's been a delight and a great joy to be with you. I've been excited to be part of the program. I know you and I talked about this a few months ago. Here we're doing it, and it's a joy to do this, but also just to realize that the presentation and our shared discussion and answering some of the listener questions, hopefully it's been a great service. And to me, there's some fulfillment in just being able to have some impact on your listeners. So delighted. Thank you.
Definitely. So thank you so much for being here and sharing your expertise. And thank you, listeners. And the bottom line is that ultimately it's about you. And our only goal really is that, did the person who really needed to hear and understand this information tonight get it? Then this was an awesome episode. And I hope it gave you exactly what you need to be able to feel like you can move forward in your healing process. And that's what our hope and dream for you is, that you heal and feel whole. So thank you so much for joining us, and goodbye.
Dr. Jeff Talks About Sex